So, when you're talking about psychiatric emergencies with fever and altered sensorium, when you're typically talking about altered sensorium, you mean delirium with altered sensorium, disorientation, and autonomic dysfunction, and those kind of symptoms, right? So, to keep it very simple, let's take muscle rigidity. If you're talking about rigidity, in psychiatric emergencies, what you would see is neuroleptic malignant syndrome, serotonin syndrome, and malignant hyperthermia will have a lot of muscle rigidity and it's very characteristic. Like, for example, lead pipe rigidity is very characteristic of neuroleptic malignant syndrome, whereas anticholinergic toxicity will typically have normal muscle tone or sometimes loosened muscle tone. So, that's typical characteristic feature which will differentiate these three emergencies, that is neuroleptic malignant syndrome, serotonin syndrome, and malignant hyperthermia, from anticholinergic side effects. When you're talking about skin, the skin could be wet because of autonomic activity in neuroleptic malignant syndrome, serotonin syndrome, and malignant hyperthermia, whereas it will be dry in anticholinergic syndrome because of the extreme anticholinergic effect. Typical history of the patient will be antipsychotic exposure in neuroleptic malignant syndrome, serotonergic exposure like SSRIs or MAO inhibitors, or even any other serotonergic drug like lithium, tramadol. Such kind of exposure will be seen in serotonin syndrome. Halogenated anesthetics, succinylcholine history will be typical of patients with malignant hypothermia. Whereas drug exposure history will say that there is anticholinergic exposure in patients with anticholinergic syndrome. If you're looking at dilated pupils, you will see dilated pupils in anticholinergic side effects and serotonergic syndrome. One very, very important point for us to remember is in serotonin syndrome, we typically will see increase in bowel sounds and brisk reflexes, which differentiates serotonergic syndrome from rest of the psychiatric emergencies with fever and delirium like picture. A brief point on treatments of these strategies. BADE, bromocriptine, amantadine, dantrolene, and ECTs are typical treatments of NMS. Cyproheptadine could be a very good treatment for serotonin syndrome. Physostigmine IV could be useful in patients with anticholinergic syndrome, and dantrolene could be useful in patients with malignant hypothermia.